present the data on behalf of the Stent investigators. Unfortunately, I cannot present you all the data because they are embargoed. They're going to be presented at ISC, but I'm going to present some of them. These are my disclosures. So Surpass Streamline is a slightly different flow diverter compared to the other ones, as 72 or 96 braided wire construction, so has a much stronger flow diverter effect compared to other flow diverters. Has an independent guide wire, so it's recrossable, and has ability of full sheet reposition and recapture. Has a stronger radial force compared to other flow diverters, and comes with longer lengths up to 50 millimeter. And in the trial, we'll design also to use for distal location like PCOM. So the Stent trial's design is to evaluate safe efficacy of the Surpass Streamline flow diverter for the endovascular treatment of patients with unruptured large or giant intracranial aneurysm from the Intracranial artery to the Terminus. It's a multi-center prospective single-arm non-randomized trial. Primary endpoint threshold based on published literature. 26 centers, 25 in the US, 1 international. Sample size was 180 patients, up to 3. So before enrolling the patient, you have to do 3 rolling cases per site to qualify for the trial. And there was an ID study conducted with accordance of clinical criteria, independent core lab adjudication, and independent committee for advanced report adjudication. So inclusion criteria, ages 19 to 80, single intracranial aneurysm, neck over 4 millimeter, aneurysm size of over 10. CA diameter must be between 2.5 and 5.3. Exclusion criteria are very long, so more than 1 aneurysm required treatment, other implants, prior stenting, documented resistance to clopidogrel, severe neurological deficits, other serious concurrent medical condition, and subarachnoid hemorrhage within 30 days from enrollment. The primary efficacy endpoints were subject with 100% occlusion, Raymond class 1, with less than 50% stenosis of the parent artery, so really tight efficacy endpoint. Also, it doesn't have to have any subsequent treatment at the target aneurysm within 12 months, and it can use more than two devices. Yes. Primary safety endpoint, percentage of subjects experienced death from major episodic stroke at 12 months follow-up, clinical follow-up, and then was adjudicated by independent clinical events committee. Another endpoint is technical success, but defined as the portion of subject with Surpass implant delivered to completely cover the aneurysmal neck. Patient population, 180 patients. The interesting part of this trial that they're not just white Caucasian, there's pretty all races were enrolled in the trial, African American, Asian American, and so on. There's a high percentage of smokers in the trial for some reason. Aneurysmal locations, this typical internal carotid artery aneurysmal location, differently from other trials, is the posterior communicating segment, which was not enrolled before. So results, I can show you just some of them. So technical success defined as the proportional subject with Surpass implant delivered to completely cover the aneurysmal neck, and it was achieved with technical success of 97.8, 176 over 180. In terms of efficacy, 68.2 patients met the primary efficacy point, which was 100% occlusion on follow-up DSA. 65.8 were in posterior communicating artery segment aneurysms. And the average device was 1.1, so I didn't implant more than one device very much. And a meta-analysis of 16 papers on flow diversion, so an average efficacy rate of 64%. So it's pretty much in range with the published literature. So in terms of safety, I cannot give you too many details, but there was 8.3% major stroke, ischemic or hemorrhagic, but they seem to be unrelated to direct Surpass deployment, either before or subsequent hemorrhages, or sometimes they were done due to non-compliance with dual antiplatelet medication. I mean, I couldn't give you too much details. There were 4 deaths at 12 months, and one is only were related to Surpass. Unfortunately, the trial was very unfortunate. The trial was very strict criteria. I see one of the adverse events was an amphetamine overdose, but it still was enrolled as an adverse event. But anyway, we had almost 90% of patients were free from neurological event or death or 1 year. And this is really in line with current literature if you consider all the adverse events. So, Stent trial is the largest prospective multi-center clinical trial on a flow diversion, included challenging posterior communicating artery segment aneurysm. Pretty good efficacy, we have an average of 1.1 stent deploys, and data are very similar to what's generalized in real-world outcomes. So as a result of this trial, Surpass Streamline has a PMA indication for endovascular treatment of patients 18 years of age or older, a ruptured larger giant aneurysm over 10 millimeters of diameter, wide neck, P2 segments up to the posterior communicating artery aneurysm. I'm going to show you a couple of cases and then I'll finish from, we were one of the first centers. So these were done with the first generation delivery system of the Surpass. You can see an ugly bilobed posterior communicating aneurysm, talking about posterior communicating artery aneurysm. The implant was not a big deal at all, it was pretty straightforward to deploy the device across the aneurysm segment. This is a device on expert CT. And then there's a 6 months follow-up on jaw with this complete obliteration of the aneurysm. And you can see there's a nice apicum filling from the aneurysm. So complete occlusion. Another large dysplastic fused from cavernous to supraclinoid ICA aneurysm. Again, very straightforward deployment in my experience and complete occlusion at 6 months. So I want to say the first case in the States was performed by Dr. Wakulu, I think like 3 days ago, and thank you very much for your attention.